Hello, this is my presentation on schizophrenia. So it's been recognized throughout history under various names: dementia precoce, adolescent insanity, catatonic syndrome, hebephrenia. Emil Kraepelin was the first psychiatrist to observe and classify disorder. He called it dementia praecox. He determined the cause was genetic and biological. He was the first to identify 9 different forms and symptoms that the mental disorder manifested, such as delusions, incoherency, personality changes, impulsiveness, mania, and impairment. Eugene Bleuler would expand upon Kraepelin's ideas. He would rename the disorder schizophrenia and identify various subtypes of the disorder. He would also identify positive and negative, primary, secondary, basic, and accessory symptoms. He helped continue to build the diagnostic profile for schizophrenia. Carl Leonard later on would expand on Bleuler's classification system, and he classified it in 3 groups: a group of systematic schizophrenias, a group of unsymptomatic atypical schizophrenias, and a group of cycloid psychoses. So the symptoms of schizophrenia, they're grouped by positive, which are added on, or negative, reduced symptoms, such as hallucinations. This can be auditory or visual, incoherent thinking, delusions, disorganized speech, impaired social and cognitive functioning, inappropriate behavior, anxiety, catatonic behavior. So in the DSM-5, schizophrenia is under the category schizophrenia spectrum and other psychotic disorders. The diagnostic criteria for schizophrenia in this version must include 2 more of the following in 1 month: delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms. A disturbance must occur for 6 months and cause a deterioration in normal functioning of the individual and cannot be attributed to substance abuse or another medical condition. Development of schizophrenia generally starts with symptoms of depression, followed by the first psychotic episode in the late teens or early 30s. So prevalence and risk factors. Schizophrenia currently affects between 0.3 to 0.7% of the world's population. It affects patients of all gender, race, culture, and socioeconomic backgrounds. However, men are more likely to have negative symptoms, experience onset earlier in life, and have longer durations of the symptoms associated with the disorder. Our environmental risk factors include minority children who grow up in urban environments. Genetic risk factors: if you have a family history of schizophrenia, psychoactive and psychotropic drug use and abuse, alleles, and pregnancy-related issues, diabetes, stress, and an older mother can also cause schizophrenia. Other risks. Individuals who are diagnosed with schizophrenia are more at risk for suicide, death, and infectious diseases. There's societal stigma to individuals who have schizophrenia, so they're at risk for various social issues such as housing discrimination, social isolation, homelessness, abuse, and neglect. The cause of schizophrenia is believed to be a combination of genetics, brain chemistry, and environmental factors. So there's a couple different common treatment options for schizophrenia: antipsychotics, cognitive behavioral therapy, and electroconvulsive therapy. Electroconvulsive therapy is generally used for patients who do not respond to antipsychotics. The best treatment option is a combination of both antipsychotics and cognitive behavioral therapy. They work really well with each other. The antipsychotics, take away patients' symptoms for them to be able to focus on therapy, and the therapy kind of reinforces, positive behaviors in dealing with the illness and making sure that the patient stays on the medication. Thank you for listening to my PowerPoint.